Welcome to Community Forum. My name is John Guglieltino and I'm your host. This evening we're going to be changing gears and getting into healthcare, and we have representatives of the Community Health Center of Danbury, and we have the director of the Fairfield County operation that we have here, Adele Gordon. She's the director of Fairfield County operations. We have Dr. Susan Bellinger, the behavioral health specialist, and we have Dr. Gabrielle Gelrick. She's the physician, which is located in the downtown Danbury. I want to welcome you all to the show.
Thank you.
Yeah, you're welcome. Now, this is always our habit here, before we get into our guidelines, so to speak, if you can tell us a little bit about yourselves, and starting with Adele here, a little bit about yourself as how you got your position, and maybe a little bit about your family, and how long you've been in healthcare. You can get into your educational background if you like. So go ahead.
Oh, okay. Well, I've had a very interesting background, not in healthcare, and I was training women for the world of work when I realized that I couldn't get them dental care for their teeth, and if they had missing teeth, no matter how well I trained them, they couldn't get a job. And I found that in Stamford, Connecticut, we didn't have a dental clinic. So after I finished that job, I started a dental clinic with the help of a lot of others in Stamford, and that got me into the healthcare business, and we opened up a dental clinic in Stamford, which was subsequently taken over by the Community Health Center Incorporated. It's a long story of how we got to Danbury, but anyhow, and from that we opened one in Norwalk, and then we also do primary care as well as oral health care. So we came to Danbury because we knew that the need was so great here in Danbury. So that's how I got into the position of Fairfield County Site Director, because we have 3 sites in Fairfield County right now, 3 main sites. So that's basically it.
Okay, very good. Dr. Susan?
Well, I live in Newtown, Connecticut with my family. I graduated Newtown High School. But then my graduate work I did at Fordham University in the Bronx. And I've been in behavioral health for about 15 years. And I got to Community Health Center through, I started working out in our Middletown office and doing foster clinic evaluations and working in the child guidance department. And then when we opened a site in Danbury, it was kind of a great fit because I'm, from this community. So it was kind of, coming home, so to speak.
Right, as opposed to going out of town.
Right.
Okay, and Dr. Gabriella?
I'm actually Canadian and moved to New York to do my training in family medicine, and did 3 years there working in the Bronx with the underserved population, and after graduating was looking for a place to continue that work, helping the underserved, the uninsured, and found Community Health Center, which was a great fit. So here I am now in Danbury continuing that same mission.
You're from Toronto, right?
No, I'm not. I'm actually from the East Coast, from Halifax, Nova Scotia.
Oh, okay. Well, I figured because there's a lot of Italians, but I guess you're not Italian either. I struck out.
Born in Brazil, ended up in Canada.
Struck out on my assumptions.
Okay.
Okay. The CHC, right? Mission statement. Yeah, you're going to give us.
Well, our mission is to serve the underserved and people who don't have access to good health care, and both who are underinsured and uninsured. And we, our mission is to do it in very well, to provide very quality care for people in that position. So that's what we do. We started in 1972 with a small dental clinic, believe it or not, in Middletown, Connecticut. and have now grown to where we have 11 sites across the state, and all the way from Enfield now to Danbury. And we provide exceptional service to people throughout the state. So that's what we're here for.
Well, some might say, well, how are you different from, let's say, the hospital, Danbury Hospital? If you're concentrating on the little people, then I guess that's your biggest argument, right? Yeah, right?
We really aren't different from Danbury Hospital. Our experiences, we've met with the Danbury Hospital. I must say this about Danbury and our experience here, that it has been totally rewarding. We have been welcomed here by everybody. We have been helped and guided by people from the city center all the way to the hospital to, what can we do for you? And so we are there to fit a niche, I would say, to enhance what Danbury Hospital is doing and do it well, because there is a capacity issue, and that's why we came. We came to alleviate some of the stress on the providers that are here because they can't handle the vast numbers of people that need the services medically, and we hope to be able to provide, hopefully, oral health care in the not-too-distant future. But and it is proving out, and the hospital is just thrilled to have us and work with us, and it's been very exciting. So I don't know that we're different. We're just more of and work to achieve the same goals. I mean, they have a very special place in Danbury, and
yeah, they got the beds, and you're like the
right. And well, yes, and they all the specialists and if our patients have to go into the hospital, they will take those patients. So we're working together as a team.
And I've heard of people saying that exactly what you're saying, the capacity. Sometimes they're just so busy with what they have at their stations, or whatever you want to call it, their outlets, that people walk away and don't get health care. So it's very welcome to have another outlet for people to go to and get services, especially if the emergency room's got a line going out the door, and there are other sites, I think there's two, are also that crowded. And
you brought up a very important piece of that, John. The emergency room is not the place to provide medical care, routine medical care. And many people seek it because they don't realize they have another option. That puts a strain on the hospital, and the cost is enormous. And so we're working with all the doctors from the emergency rooms as well to try and get them. And they're actually referring people there who need primary care to Dr. Gelrich because that's where they belong.
Yeah, the next question was going to be what services are provided. You don't have beds for them, but you do all of the. I'll let you.
Well, I'm a family physician, so I've been trained to take care of everyone from the newborn to the great grandparents, and that includes everything in between as well. So we provide chronic health care basically and attend to everyone's needs. Whatever can be done. I mean, the critically ill patients will end up in the emergency room. That's the place for them. But coughs and colds, pap smears, that kind of things, mammograms, colonoscopies that need to be done, we can schedule things like that are very important to have done and don't need to be seen in the emergency room.
Okay. Now we have building a healthcare home.
A medical home where a patient can come and get all their needs met in one place. So whether it's behavioral health, medical, and soon to be dental, the patient's treated holistically. And things that might fall through the cracks if a patient is being seen by multiple doctors at multiple sites, we try to track and keep on top of.
Yeah, part of that is we believe in prevention, and we stress prevention because we believe that produces healthy outcomes in the end. So if Dr. Gelrich is working, a patient comes in to see her because he's got an infected toe, and in the morning the whole team will huddle. They meet together, including Dr. Belanger. They will huddle together and they will take a look at who's coming in. They say, oh, Mrs. Smith's coming in for her infected toe, but look, she hasn't had a mammogram, she hasn't had her flu shot. So we can get her in here and have all those things taken care of and not just treat the symptom, but treat the whole person. And that's what really distinguishes us as a medical team. This was the first site that we've built that is built to accommodate that kind of routine. We have all our behavioral health offices set right into the primary care, so that if a person has a lot of anxiety that day, and Dr. Gellert says, you seem a little distressed,
your
come,
blood
I want
pressure
you
is
to
160 over 80.
Right.
Whatever.
Just walk you down the hall, right to Dr. Belanger, and maybe she can help you out. So we think we're very much ahead of the curve in this kind of medical home and medical practice.
Okay. Leader in primary health medical through innovation. Okay, so
Yeah, we're
what kind
leaders.
of the innovations that you refer, you've already mentioned some of
I
it.
mentioned some of them.
Right.
Right. And Dr. Gellert maybe could tell us a little bit about the electronic health records that we use and
okay,
how
that's a big thing coming in.
So part of our innovation is this technology that we have access to, and one of them that I use on a daily basis is the electronic health record. So everything's inputted and it keeps great continuity. You're not having to look for paper charts, losing papers. Everything gets scanned into a system and is there. And as well, because we have 12 different sites across the state, I can look at that file in Danbury, as can a provider in Middleton. Say the patient ended up going to Middletown for some reason. So it's all there. It's continuity of care, which is the most important thing when taking care of a patient.
And like you said, it's not like there's 10 sheets of paper and they're in a file, and
Right.
it might fall and you lose a couple.
And especially for patients that we share, it's a fully integrated behavioral health and medical record. So a primary care physician can look at behavioral health issues and vice versa. And the fact that it's electronic makes illegibility of handwriting
So if
a
a
non-issue.
person's on some type of medication, they know right away the medication for the behavioral aspect is also brought in.
Right, and it's a great way to communicate in real time with, if I'm seeing a patient that's also Dr. Gelrich's, then, and she's or he's complaining of any kind of side effects or anxiety about any medication or treatment, and I can alert Gabriella through an encounter system that we have built into the record.
It also reduces the possibility of error too, when because we can do e-scripts with the CVS, Walgreens, the different pharmacies around here, and with the labs, with Quest Lab, and the different partners of ours in the community, so that a person gets their prescription. It's clear. We don't rely on those handwritten problems that we used to have, and you don't have to go, like you said, digging 2 pages back to see what happened. Everything is right there. So that clearly is the way that most people are going, and I think you were talking about earlier about President Obama, and one of the thrusts of that administration is electronic health records, and we are right up there. We are looking at ways of integrating our dental records in there. So probably by spring or early summer, we will have everybody will be on electronic health records, and that's going to be a real innovative thing for the area.
So if somebody's a bleeder for purposes of dental, then you can check it and see is the blood pressure too high, or even though it's been okay in the past, is there what's causing that? There might be
allergies, everything.
Gum disease,
Medical
which
problems.
is connected to heart disease today, or it just grabs everything for that particular patient.
Now there's a term here, like maybe somebody can explain it, advanced access scheduling.
Oh,
yeah.
Sure. Who wants to take that on?
Well, it's really trying to meet the needs of our patients. So if somebody calls to schedule an appointment, they'll be seen within 3 days, either today, tomorrow, or the next day.
None of the 2-week things.
No.
Okay.
I mean, people call with a pressing issue, and in 2 weeks from now, it could be something totally different. It's not meeting their current need. So advanced access scheduling allows us to treat people in real time.
Yeah, that's when they're sick.
Right.
They might not even be with us
Right.
in 2 weeks
That's
or
right.
3 weeks.
That's right. I mean, and that's pretty unusual, because I know I called one of my own doctors, and they said, coming in about a month, and I thought, no. So I mean, our patients are really being seen. We do not even book out more than 2 weeks. We don't even open our schedule, so that it really forces us to follow that and keep it going, and we do see that. And the other thing with this is there's no sitting in our waiting rooms for long periods of time waiting, and we've all experienced that. So that's a real benefit.
I used to go through that with my mother. I get there
the same thing.
you get there at 10, and you're lucky you get in through there. Lucky an hour and a half, if not 2 hours, to get in the door.
Right.
Yeah.
We've had a mutual experience.
Let's see here. Then we've got integrated care for behavioral.
Well, I think
we
we
talked about that. And teamwork
about
and planned. We already talked about somewhat of that. The planned care. The technology, we've talked a little bit of that. Electronic health records, digital X-rays.
Oh yeah,
That's one I don't know.
Well, we do. Well, when we have our dental clinic here in Danbury, we're completely digital X-rays now, and we, as a matter of fact, even just got a what we call, it's a ScanX, and it will take digital X-rays at our portable sites. We not only have 11 sites throughout the state, but we also have well over about 135 different sites, what we call mobile sites, in schools, in clinics, school-based health clinics, and we do, for example, in Norwalk, we do all the schools with hygiene. But in order to do other work, you have to have, if you know, restorative work in the schools, you have to have an X-ray machine. And because we're all digital, we needed a digital X-ray. So we were lucky enough to be given a grant for the digital X-ray portable, and now we'll be able to do restorative work where people are. That's one of our mottos, is where the kids are. We go to them, and be it medical or dental, and try to take it to the schools and to Head Start programs and WIC programs. And
so even medical. I thought you were just talking about dental.
No, the programs that we take out we have medical programs. We have a lot of school-based medical programs as well. But the digital X-ray is just for, right now, just for oral health. And it's pretty innovative to be able to do that on the road. So
they wouldn't call them CAT scans anymore. They call them bird scans.
Bird scans, right.
Okay. They're flying, through the air. Try to be funny.
That's true.
Let's see, the remotes. We just talked about the remote services and language line. It's a language line.
Language line is basically a telephone you have access to for interpretation services.
Okay. Literally language line.
Right.
Literally language line, that's right.
So if someone's Portuguese or someone's Hispanic,
they can communicate in their native language via an interpreter, and that makes the whole ordeal a lot easier.
Let's not leave the Brazilians out. They get angry when they say that they're all. I know it's Portuguese, but there is a little bit of a difference.
Yeah. Well, the language line is you must have seen where a parent will come. The child knows English because they're in school here, and the parent will have the child translate. Well, we're talking about medical issues, and it's not always appropriate to have your child translate. So the language line is medical. It is staffed by people who know medical language. And there's one in every operatory for dental and one in every exam room for medical, so that it's instant. And although our staff is multilingual in the clinic in Danbury, there are times when you might need the language line in addition to it, and we're fully staffed and we use it. You have used it, Gabrielle?
Definitely, quite often actually.
Quite often. It's a big adjunct to taking good quality medical care.
In all fairness, I think that's sometimes the other entities, like the emergency room and the other sites where they, that's part of the problem. People have the language problem. Oh, well, the interpreter's busy down at that end and they can't get over here and it's going to be an hour. So, you know, something that should be done in an hour or two turns into a 4-hour thing because they're so tied up with the language issues. You know, so
it's a costly project, but it is well worth it for the care that it provides for the patients. So.
Right. Now the data-driven care, I think we pretty much covered. Or is that something different?
That is something a little different. We are a very data-driven organization, so we monitor everything that we do. We monitor the number of times people come. We monitor if people don't show up for appointments, which is a chronic thing, but I must say that our numbers are far fewer than of no-shows than many other organizations, so we feel very good about that.
Will they like you?
I hope so. We like them.
If you don't have them sitting around for 3 hours, they like you.
That's true. We're very big in healthcare and hypertension, diabetes, and we monitor what we do in those areas because those are two of the most chronic illnesses that people come to us with. And so we monitor that very carefully. We've been in studies for and been awarded grants to study that. We also, not here, but we are doing a big oral HIV project with the federal government. And we are bringing people from we are going to be offering it to people from Danbury to come down and be part of that study, and they get free care. And so
you're talking about Norwalk, Bridgeport?
We're talking about having people come from Danbury to Norwalk at present to do that and have them be part of that program. So we're looking into ways of making it accessible for them. And we have outreach to people in Danbury already. We've started that process. So without the data, you know, you don't move forward. And the other thing is we monitor our successes and we monitor things that we wish we could do better. So we keep that data and we meet quarterly to discuss that to see where things could be done better. And so we're always monitoring what we do.
Now, there's a reference here to health professional training.
It's very exciting.
CHC
is like continuing education, or
well,
no?
we got something. We do that. We go ahead, Sue.
No, I was just going to say CHC really offers its staff, you know, continuing professional education and continuing training. So you know, time and paid time off to do that. So it's, you know, if there's a skill that needs to be honed and there's an interest, then they fully support that professional development.
And in addition to that, we have launched last year an APRN program for advanced nursing. And they were one of the few groups who did not have, professional groups, who did not have the opportunity to do a residency program. There was none in the whole country. So Dr. Margaret Flinter, who is a vice president of CHC and is an APRN, decided that that would be something that was very worthwhile, and that was sanctioned by the state of Connecticut. And we did our first APRN residency program last year with 4 students, and 2 of them remained upon graduation with us, and 2 of them went out into other health providers. And this year we have 4 new people, and it's a very exciting, because it's the first one in the world, not only in this country, that we have a residency program for advanced nursing. So that was very exciting.
Very good. There's a reference here to community partners. Does that yes, community partners, does that mean the social service agencies, or does that mean the other healthcare professionals in the community, or is that both?
Both. Both.
I sort of figured that.
Yeah, both. You know, again, I just say that it has been really exciting to be here. We've met with, well, when we first came, and we do something that's a little different. We have what we call our access to care workers go out in the community and walk the streets talking to people and giving them brochures and telling them about us. As a matter of fact, our receptionist met one of our access to care workers on the street, and she said, "Oh, I'd like a job with your agency." And we hired her, and she lives right around the corner from DeLay Street. And so we met a lot of people that way, and we met with the Housing Authority, and they said, "Oh, please come tell our residents about it." So we had another community partner.
You met me at a Kiwanis project.
I know. I've got to get to the Kiwanis. I'm embarrassed about the Kiwanis
No,
project.
I was mentioning that's how I became aware of you. I was at a Kiwanis project at the downtown skating rink.
Oh.
Yeah, that's how I became aware of you.
Okay.
Right.
Yeah, you had some kind of event there at the same time we were
We
doing
had a
a
table
project
set up
there.
there.
Yeah.
Yeah.
Yes.
Yeah.
So you know so reaching out and getting out in the community, that's how you meet people.
Mm-hmm. And we don't have borders, so you know, for the people who live in New Milford, I've met with the people from the hospital in New Milford, and you know, we're here to provide a service, and you know, whether it's Bethel, New Milford, Sherman, you know, wherever people need help and we can provide access for them. We're here.
I just wanted to get this point in. I think you'd appreciate it, but we didn't cover this. Do you have a website?
We do.
You have a website. You want to mention your website for information?
Sure.
Yeah.
It's www.chc1.com.
Okay. So you're our version of Doctors Without Borders, because you travel all over the area, right?
Right. Or that people travel to see us, yeah.
We got, they're waving goodbye, so I want to thank you for coming on the show, and I want to thank the viewers for tuning in to Community Forum. Tune in next week, same time, same station. We'll have another interesting program. Good night for now, and we'll see you then.